Depending on the procedure schedule, the patient will be positioned either supine or lateral. There are a variety of incisions used in cardiac procedures, so make sure you learn them. The median sternotomy is in the midline of the chest and is most commonly used for open heart surgery. It requires a sternal saw. The paramedian incision is indicated for minimally invasive surgery of the heart and for lymph node biopsies. Anterolateral and posterolateral incisions require the patient to be in modified supine with rolls under the shoulder and hip on the affected side. Finally, many thoracotomies are used specifically in MIS and robotic procedures by making a 2-inch incision between the ribs on either side. Your book goes into great detail on page 898 for these incisions and a few more, and the necessary perioperative considerations to be made. As you can see, the instruments will be a general set with lots of additional specific pieces. The instrumentation can be quite complex. Exceptional organization is required during these procedures. You can understand now why the healthcare provider should be experienced before jumping into cardiac procedures. It's not uncommon for facilities to require a standardized setup for these procedures, so no matter what, anyone can scrub in and know exactly where everything is. There's no time for individualization of setups during critical cases, such as those performed in cardiac surgery. You remember the Rommel tourniquet from peripheral vascular, and that it is used to hold suture in place and to occlude major vessels. Recall that it can be a short piece of commercially prepared rubber tubing, or a Red Robinson catheter may be used. It and its stylet must be included as counted items for the procedure. Coronary artery instruments are fine and delicate. You must handle them carefully and inspect them before, during, and after use to ensure they are safe. Valve instruments are a special subset of instrumentation that have the capability to retract the valve as well as size the valve during replacement procedures. Aneurysm instruments will be both heavy and fine. Heavy so that the vessel can be occluded, and fine so the vessel wall can be dissected free of plaque buildup. Endoscopic instrumentation is very much like what we've discussed in previous units involving endoscopy. Remember, there will be ports, CO2 insufflation tubing, camera heads, fiber optic light cables, lenses, graspers, staplers and scissors, in addition to the non-sterile equipment like the monitor, light source, and CO2 insufflator. Don't forget that all this specialized equipment is required to perform the procedure itself, but it can't be done without retraction instruments. Mainly sternal retractors such as the Ankini and the Finochietto sternal retractor. You can see many of these instruments in your text on page 899. Vessel and patch grafts are available for use in cardiac surgery as well as peripheral vascular surgery. They come in straight and bifurcated options, varying lengths and diameters as well. Because there will be an incidence of both large and small artery replacement and anastomoses, it's important to note that small and delicate artery anastomoses will use knitted grafts because they are soft and porous, while large arteries will require woven grafts that are tight and prevent blood loss through the graft. Pre-clotting is a technique that is not often performed anymore, but you still need to know about it. So pre-clotting is a method by which we prepare a synthetic graft to prevent it from leaking. It provides a seal between the fibers of the graft. The team needs to obtain 30 to 50 mLs of blood from the patient before they're heparinized. It is seldom performed nowadays, though, because the woven and knitted synthetic grafts are now impregnated with collagen, which seals the graft to prevent leakage. Should you have to perform pre-clotting, the big thing to remember is to use non-heparinized patient blood, flush the graft with said blood, and then place in a small basin until needed. The two most commonly used prosthetic valves are the St. Jude Medical mechanical valve over on the left and the Hancock porcine valve on the right. The St. Jude valve acts as a valve by opening and closing like shutters on a window. So you can see these flaps right here. When it's working, those flaps open and shut, open and shut. whereas the porcine valve over here acts like a human valve because it has leaflets that open and close right here. Regardless of which valve is in use, it's important for the ST and the circulator to verify the type, size, ID number, and expiration date before opening the packaging onto the field. Also, valves should be handled as little as possible.